Before entering the patient's room, I will make sure I have all of my supplies with me. Hand hygiene for 30 seconds. Hey there, my name is Sjsu. I'll be a student nurse today. So first of all, let me take a look at your wristband. And can you please say your name and date of birth for me? Natasha Green, 1989, October 4. Great, matches my record. So first of all, let me ask you some questions. Okay, great. So first of all, do you have any allergies from medications, chlorhexidine, rubber latex, anything like that? No, great. Do you have any pain going on today? How are you doing today? Or you have pain, or you have discomfort around your pelvic area, around your urinary bladder. Actually, that's the reason I'm here for today. As your doctor have put an order for Foley Catheter insertion. He has put an order for it due to your urinary retention problem. So that's the procedure we'll be doing today. Have you ever had it done on you before? You have? Okay. So basically what's going to happen is that, I'm just going to give you a quick walkthrough. What's going to happen is that I'm going to clean your perineal area twice. And then I'll be inserting the Foley catheter, which will be lubricated in there into your urethra. And I will be, it has a small balloon attached to it, which I'll be inflating so it doesn't fall out and doesn't let the urine leak. And I would collect the urine sample, 5 to 6 ml, just for lab works, and attach the catheter lining to the top of your thigh. I will be attaching the Foley back to the bedside, making sure its level is lower than your bladder so that urine passage is easy. Okay, does it make sense? Great. Do you have any questions or concerns? No. Great, perfect. Alrighty, first of all, I will do hand hygiene. Put my gloves on, and I would clean the table, wipe the table for 30 seconds. Making sure that I get all of my corners nice and wet. Getting all of my corners. Nice and water. Perfect. Has been wiped for 30 seconds, and now I will let it air dry for 2 minutes. Great. Hand hygiene for 20 seconds. Now it has been air dried for 2 minutes, and I will bring my supplies in. I will keep these packaging aside just for a second, and I will now open my Foley catheter kit with no touch technique. Perfect. Great. And since I do not need my sterile gloves, I'll be taking this off right now. And since we do not need this, I will be disposing it, and I will be putting my packagings into my sterile field. First of all, sterile syringe. Great. Dispose it. Here goes our chlorhexidine swab. Great. Here goes our stabilization device. Open it. Perfect. Great. And now I will be closing the curtains for privacy, and I will be doing hand hygiene and putting gloves on. And Mrs. Green, now I will be cleaning you around your perineal area, And is it okay if I lift your turn your blanket down and gown up? It's okay, great. And I will be cleaning it. That's fine, right? Okay, great. Thank you. So full. Great. Alrighty. Thank you. And since I see Chuck's already under there, so that is great, and you are in spine position, so that's perfect too. And I would assist you to put you in frog-like position as it is. Good for this procedure, recommended for this procedure. Great. I would assist the procedure, okay? Perfect. Alrighty, are you comfortable? Great. Alrighty. I will be cleaning you, okay? Perfect. Is it okay if I touch you? Great. First, middle part. Great. Then left. Great. Then right. Great. Alright. Is it okay if I leave you uncovered just for a second until I put my sterile drape and sterile gloves? Is that okay? Great, perfect. I will be getting rid of the wipes and change. Dispose my gloves and hand hygiene. Now I'll be putting the sterile drape. Shiny side down. Perfect. And I'll be putting my sterile gloves now. Hand hygiene, 20 seconds. Sterile gloves. Alrighty. No touch technique. Technically 1 inch border. And picking it up. Great. Perfect. Great. And I'll be tossing that out to the garbage. Good. Alrighty. So now I'll be setting up my equipment. Perfect. And first of all, I'll be taking this out. Great. If you do not need this, I will dispose it. Great. And this is my urinary cup. I'm keeping it out. And open my alcohol swab stick. Keep it over here. Attach my injecting inflating balloon syringe over here. Great. And perfect. And I'll be putting the disposal. Perfect. Great. Alrighty, getting into lubrication. Great. Keep it on the side. Perfect. And dispose it. Alrighty. Great. And I'll be also opening my urinary cup. Great. And I'll be carrying my catheter kit to the patient. You doing good over there? Great. Alrighty, so I'll be cleaning you again, okay now? Great, perfect. Okay. You doing well over there? Great. Cleaning middle part first. Dispose it. Clean the left side. Great. Clean the right side. Perfect. And dispose it. Great. And now that it's air dried and it has been air dried, and can you please take a deep breath, and on 1, 2, 3 please breathe out, okay? Great. Alrighty. Perfect. Alright, 1, 2, 3 breathe out. Okay, I see the urine coming out. And also, can you please I will insert in advance 1 to 2 inches. Alright, do you feel good? Alright, great. Now I will inflate the balloon since it has been in there. Alrighty. Feel the resistance. Good resistance over there. I will take off the syringe. Perfect. There is good syringe resistance, so that's perfect. And now I'll be covering the patient for dignity, and take CHG swab for cleaning the port and then collecting urine sample. 5 seconds. Great. and then get my syringe, 5 to 6 mLs. Perfect, great. Alrighty, I'll be great. I'll be disposing it, and I'll be putting MRN, name of the patient, and date and time of the procedure. And okay, great. And now it's time to put the stabilization device. And hygiene for 20 seconds, and putting gloves on. And first of all, I'll be cleaning top part of your thigh with the skin protector, and then I will be using my stabilization device to connect it. An arrow upside towards you. Perfect. And now, since it has been dried, I will be connecting it. Great. All right, perfect. Great. Great. Now I'll be attaching the Foley bag to the bedside. And are you doing good over there? Are you tolerating the procedure well? Okay. Do you have any pain or anything like that? No? Great. I'll be disposing my material. Great. And did you tolerate the procedure well? You did? Okay, great. I'll be disposing the gloves and changing the gloves. Alrighty. Did you have any pain? No pain? Great. Alrighty. Did you feel that there was a relief around your urinary bladder area? You did? Great. That's good to hear. Put you in normal position. Perfect. And I will be covering you up now and pulling up your blanket. And you want the blanket on, right? Great. Alrighty. Perfect. Alrighty. And as you said, you didn't have any pain. You tolerated the procedure well and you felt relieved, right? Alright, great. And did you have any questions and concerns? No? Perfect. And I will be putting the bed in lowest position, pull up 2 to 3 rails up, and I will give you the call light bell and make sure there is no hazardous material. And now I'll be leaving the patient's room by hand hygiene and picking up my urine sample. I will leave the room, and I had already put the details on the urine sample. Date and time of the procedure, MRI, and the patient's name. I'll be leaving the patient's room documenting date and time of the procedure, name of the patient, amount and description of the urine, size of the catheter which went in, and patient tolerance of the procedure with the name of the patient. Great, perfect. Thank you. And hygiene for 20 seconds. Hey there, my name is Sjsu Nursing Sem. How are you doing today? Doing good? Perfect. Before, first of all, I will be checking your wristband. Can you please say your name and date of birth for me? Natasha Green, 1989, October 4. Great. This is my record. Perfect. And before starting, I would like to ask you some questions. Is that okay? Great. And do you have any allergies from medications or chlorohexidine, something like that? No? Great. And do you have any pain? No pain? Perfect. And are you able to empty your urinary bladder well? You are? Great. And you don't feel any uncomfortable feeling around your bladder? No? Great. And so today I will be removing your Foley catheter. That's the procedure we will be doing today. But before removing, I will be deflating the balloon and remove this stabilization device too, and dispose the equipment. Does this sound good to you? Does it make sense? Great. Do you have any questions or concerns? No? Great. Alrighty. So first of all, I will close the curtains for privacy, do hand hygiene, and put gloves on. And Mrs. Green, is it okay if I pull down your blanket and gown for the procedure? Is it okay? Great. Alrighty. First of all, do this. And is it okay if I put you in frog position for the procedure? It is okay? Alright, great. Alrighty. Do you feel comfortable? Perfect. I would put towel over here for the procedure so that nothing spills. And I will remove the lining from the stabilization device. I would get my syringe, and I also see that you're in supine position, so that is great. I'm deflating the balloon now. Deflated the balloon. So please take a deep breath and breathe out when on count of 3, okay? 1, 2, 3, breathe out, and I'll take your balloon out now. Perfect, great. Alrighty. And if I was unable to take the balloon out after deflating, I would have deflated it again, okay? Remove the more water. I would be covering you now. And if I wasn't able to take out the balloon even after then, I would have called the provider, okay? Great. Alrighty. So now I'll be using the alcohol swab to clean the stabilization device and expose it. And now I'll be carrying the Foley catheter and Foley bag to the restroom for measuring it with the help of graduated cylinder and disposing it. Disposed it and measured urine. It is 400 ml and clear and yellow. I will be removing my gloves, disposing it, and hygiene. Urine is clear and yellow and 400 ml, and it has been disposed into appropriate recipient bin. Alright, great. Now I'll be putting you into normal position. Alright, great. Okay, great. Now I'll be covering you up properly and pulling back your blanket. And did you have any pain during the procedure? No. Did you tolerate the procedure well? You did? Great. Alrighty. Did you have any pain? No pain? Perfect. And do you have any questions and concerns? No. Alright, great. Alright, so I would like to go over a couple of things with you. So basically, for next to voids, it is really important to measure the amount of urine which will be voiding, to make sure, just to know that your urinary bladder is being emptying properly. And also, if you have any burning or stinging sensation, that's totally normal. It will go away by time. And if you're not able to urinate, if pain is worsening, and if you have blood in your urine, tell me no, or other nurse, or tell the provider. Okay, does this sound good to you? Do you have any questions, concerns? No? Great. Alrighty. I will pull up the 2 to 3 rails up, give you the call light, and put the bed in Lewis position. Remove my gloves. Do you have any questions and concerns for me? No? Good. Alright, I will leave the patient's room, do hand hygiene, document all the information, date and time of the procedure, name of the patient tolerance, amount and description of the urine, and next 2 voids. Great.